My name is Monique Smith. I am the owner and lead instructor at American Dream Farm in Statham, Georgia. Always had an interest in horses, started teaching years ago. I bought Zip as a 2-year-old stud colt. I was a little nervous about that, but I was assured by my good friends in the equestrian community that that was no problem. He's now 17. Zip was actually diagnosed with PPID when he was 14 years old. A little early, a little young. We first noticed that Zip was a little lethargic, not hanging out with the herd as much, and we started to notice a little bit of hoof soreness in his 2 front feet. Nothing major, just something very slight. The biggest indicator, I think, was when it was time to bring them in to eat. Zip wouldn't come up to the gate, which, when it comes to food, Zip was usually the first one in line at the buffet. So we just watched him for a couple of days. And then the progression came quickly. He ended up with laminitis about 3 days later. We wanted to hit him hard with the Cadillac approach, so we did the big blood test to be sure that we were treating PPID. He was tested positive for PPID and equine metabolic syndrome. It was highly suggested by my vet, Amy. She said, if you want to be aggressive and get this horse well, let's put him on Prascend. I immediately, before she even finished the sentence, absolutely, let's do it. The beautiful thing about Prascend, not only the fact that it works, but the fact that giving it to your horse, it's a little tiny pink pill. They get it once a day. We put it in Zip's food, and he eats it. Any horse owner should be aware of PPID. And don't go by the standard symptoms. Your horse has to be older, or your horse has to be a quarter horse or a pony. Your horse has to have a pot belly or start losing some muscle in the top line. If a horse owner starts to see one little symptom that might point towards PPID, they're probably right, and I highly suggest get the blood work done. I would tell horse owners to pay really close attention to their own horse, know your horse's personality, and keep an eye on them, because it can happen to any horse. It really and truly can. I would say that, thank God, Zip is living the good life. He's brought a lot of people happiness, myself, my daughter, my husband, and still gets plenty of attention around here from the students.
Important safety information. Prascend is for use in horses only. Prascend has not been evaluated in breeding, pregnant, or lactating horses. Treatment with Prascend may cause loss of appetite. Most cases are mild. Prascend tablets should not be crushed due to the potential for increased human exposure. Adverse reactions may occur if animals other than horses ingest Prascend tablets, not for human use. Do not ingest the product. Refer to the package insert for complete product information.